Good morning, everyone. Welcome to another episode of the Healthcare Inspired podcast. This is episode 9, and we are here to talk about some of the final elements of the compliance program. I want to invite on the stage my amazing co host, Maya Turner. Hi, Maya.
Hi, Jennifer. Good morning, everyone. Hello.
Good morning. I love your hair these days, looking fabulous.
Oh, thank you.
Very,
She's
very
coming out of the
nice.
closet.
I see. Well, looking exciting nonetheless. Very cool stuff. I know. I just went and got my nails done yesterday. I missed having my nail partner with me, Maya. I've had
Oh,
to do it by myself, but I had my regular girl with me. She's amazing, by the way. And I want to tell you something. I was talking to a friend this morning, and we both go to this nail lady, and she is from Ukraine. She is
really?
fabulous, but she has this whole amazing environment that's just so inviting, and it's just her and I in there. It's just a very really low key, comfortable. She has movies on in the background, it's just her and I in this room, and it's just so great. But she does sculpted nails, and the way that she kind of figures out how to kind of heal up the edges of your cuticles, she doesn't clip them. She actually files them down, and you would not believe what my nails looked like before I went in there from all this winter weather, and then how they came out. So I want to show you. I just love
Oh, you
my
got two
nails
tones? Oh,
so much.
fancy.
I had to show everyone. So anyway, loving it. So that was my self-care that I did for myself. And, I have to put self-care on my calendar. I have my amazing new social media and my project management team that is helping me get my life together so I can have self-care for myself. It's so important these days. Don't you agree?
It really is. It really is. And the point of self-care is to pull away and regroup instead of always thinking about that. And if you don't take time, I read something that was 8, 8, and 8.
Okay.
8 hours of work, 8 hours of family, and 8 hours of rest and or self-care. So it just makes it a really important element of your life, right? Because people have heart attacks because they keep working and thinking about work, and they don't learn to do self-care. So that's important.
It is. And at the end of the day, it is a job, and it is, yes, what helps us feed our families. And we can't worry too much about that piece of our lives because there is other ways that we can make money if we're destitute and we feel like, okay, I just need to take a break here. It's
Yeah,
okay to do that.
yeah, yeah.
It's okay to make your life not about work, and I'm the first one to admit when I have a problem with that. And so I've learned lately that it's okay to say no to projects. It's okay to say I'm done for this week. I'll get to it next week. I've been learning to prioritize my tasks a little bit better so I have time for my family, for my friends, for those that really need me, and of course for myself. Of course, it's what I've my new thing for 2025 is to really start putting myself before other things that are not really as important as we probably make them.
Yeah,
Um, so
yeah, yeah, yeah.
before we get into today's episode, I just want to take a moment and give my condolences to the families um, of Brian Thompson. And such shocking news coming out of New York today. As many of you might have heard, the CEO of United Healthcare was shot this morning, and I have no words. I'm not going to go into it too deep because there is a time and place for discussions like this, and I don't like when the media tries to put their own spin on things like this. It
Yeah.
will be talked about, and it will come out, all the details, I'm sure, in the coming weeks and months. But what I want to focus on today is the condolences to their family, because like anybody else, we're all human. No matter what decisions we've made in business or in life, nobody has the right to take another's life. And so I think that it's something to just think about the world we live in. Hold your family tight today. Just pray for the family because they did not deserve this to happen to their husband, father. He was somebody to somebody else. So I want to
Yeah.
just say I'm sorry that happened, and we're all thinking of you. But let's get into our episode today. I know that it's an important topic. The way that we kind of structured these elements of the compliance plan was to focus on what we needed to talk about for each segment. And so today we're actually going to talk about 5 and 7 because we talked about 6 last time. Because 5 and 7 to me, they kind of like go together when we
Yeah.
enforce the standards, right? And then we have to respond to offenses when they don't actually respond well to our enforcement activities, right?
Yikes. Yeah,
Yeah,
I mean, to me, when you think about all of these elements, that they're put together for a reason, right? They're put together for a reason because obviously something has happened for you to put the elements together. And I always like to think of this like an ICD-10 code, right? Or any type of diagnosis code, right? The diagnosis code cannot happen unless it has happened to someone, right? So you have to think of it that way. Like I saw one where someone was impounded in space. Like, okay, we don't know what happens in space, right? But again, you still have to have a reason to create something. So the OIG was very much on point, and they had to have seen it at least more than once in order to create these rules and regulations for people to follow.
exactly. So, element number 5 we'll talk about first. This is enforcing those standards and really helping our teams understand the consequences surrounding violations that are put in place. And when you go into an organization, let's say you get hired into a healthcare organization, a hospital, or a practice, and they start telling you, okay, we're going to do our compliance training, and you start reading and watching videos and you're getting into it, and maybe you don't understand, like, why is this a thing? Why do I have to follow this? Well, that's where you could maybe dig a little deeper, ask questions, but all of the guidelines and regulations are based off of things in life that are true. In I don't know how else to say this, but they just make sense from a common sense standpoint. You have to have rules and regulations for you have different people from different backgrounds, different ways of doing things coming together into one organization. And so you have to have standards everyone follows. If everyone's doing their own thing, it's chaos. And it's the same thing, like we mentioned this before. When you're on the road driving, you have traffic laws. If everyone decides to go on a red, we have a problem.
I was just thinking that.
Right? What happens? And it has happened, right? People not
Yeah.
figuring out the stop signs, right? Whose turn is it? I'll go. No, you go. It's like, come on. It happened to me today. I'm like, okay, I'm gonna go because it's my turn. So it's like it's something that we have to deal with in life where you have standards in place. And some people take the law into their own hands, which we
Mhm.
saw recently, and that's not okay. And
It's not.
just like that in an organization, it's not okay to take the law in your own hands or to decide for yourself what rules you're going to follow and which ones you're not going to follow.
Absolutely.
Um, and so let's talk about are those in leadership, right, for a minute. Those in leadership, they have the responsibility to make sure that these things are enforced. And so the one thing that I caution organizations when you bring on someone in leadership or when you are looking at one of your leaders, just know it's not an easy job they have. But if you are in that position, you have to know this is part of your job. And I know it's not a comfortable part of your job, but it nonetheless is part of your job. So let's talk about this for a minute, Maya. What are some of the qualities that a person in this role has to have to be able to enforce standards?
One, you have to know how to communicate, and you have to know how to be assertive. Uh, a compliance role and understanding both sides of the coin. You have to put yourself in a perspective of understanding the person that you're speaking to's position, and then the role that you're playing to enforce and or create a culture where there is a communicative standard. But if people do not feel that they cannot talk, then that's the wrong environment. And the goal is to be what's the word I'm looking for? Be multidimensional by understanding the role of the person, but also understanding what rules and regulations have to be in place in order for the person to be understood and to know what regulations need to be followed. And I think that at the end of the day, that's extremely important.
100%. And so I think one of your best lines of defense is if you're not quite sure what you're supposed to be doing, get out the official compliance guidance document that was released in the last year from the OIG. And I want you to go all the way down to elements 5 and 7 if you can, and do it today. I mean, while we're talking about it, make this part of your week, what you're going to do, and go into that element number 5 and look deep at what it's talking about. Because when you go to that document, I'm going to read some of it here.
Okay.
It says here in the very first paragraph of that document, for a compliance program to be effective, the organization should establish appropriate consequences for instances of non-compliance, as well as incentives for compliance. Consequences may involve remediation, sanctions, or both, depending on the facts. Incentives may be used to encourage compliance performance and innovation. Both incentives and consequences are important to enforcing compliance. And that is right from the OIG, the Office of Inspector General, the horse's mouth, guys. Read those paragraphs. There is a whole section under consequences and incentives. And that is something to be important. And one thing it gives as a tip in that document is although an entity may not be able to publicly recognize an individual who raises a substantiated concern that results in the mitigation of harm or risk, the entity should find a way to recognize this in the performance reviews of individuals. So maybe there's something that they can't actually say publicly, but they can recognize them in a private performance review. So that's a good point, because sometimes we can't always, because of certain situations, maybe they brought something to our attention that resulted in a legal case that did affect the organization, but it was a good thing. And they can't publicly acknowledge it, maybe because of certain reasons, but they can say in a private review, good job. We're so grateful to you that you did what you could to protect the organization. And so that is a great, I think, thing to think about when you're trying to incentivize. You can do things like public incentivizing, or it's everyone, hey, this is what we're going to do if we do this, right? And make it something that people understand there's a benefit to it, but they understand why we're doing it. And when you get corrected or you get correction from an organization, a manager, supervisor, please don't take it as personal, and don't make it personal either. When it comes to the organization, it's an organizational thing. It's to protect the organization. It doesn't mean I don't like you. It means that you violated a compliance policy that I have to enforce now. And I have to enforce the consequences of this action that if you had, of course, obviously read the compliance guidance, which you should have, our policies, you would know that this is a violation. And we all make mistakes. Own up to your mistakes. And then what we're going to do from there, we're going to figure out how to correct those errors. So element number 7, Maya, responding to detected offenses and developing corrective action initiatives. So why is it important now to recognize our mistakes and now correct them?
Well, first of all, when you became an employee, because I'm going through all of my compliance guidance.
Love it. Yes.
And so, one thing that I've always said is that when you acknowledge that there is an issue, right? When you signed on for an employer, there's a whole bunch of paperwork that you have to sign, right? But within that paperwork, it says that you're going to be compliant within that paperwork, that HR paperwork, and I think just like when you become a new patient, you sign all these papers, but you're not reading everything. You just want to sign so you can see the doctor. But at this point, when you are a employee, and you are in the healthcare environment, there are certain rules and regulations that are understood, but they're outlined to you when you become an employee. And I think part of that is to continually remind the employee that these are the rules and regulations that are associated with your position. And when you don't follow them as a leader, as a person who is in, in charge of that compliance, you have to constantly remind them. That's why part of the whole compliance venue that the OIG states is education and training. That's part of your education and training. And so you should be very, very, very well aware of that, to know that when it doesn't happen, you know, you have to acknowledge that you have done something wrong, and it's part of the leader's position to make sure that they understand what they did wrong.
Exactly, exactly. And we're going to do the same with element number 7. We're going to read directly from the compliance guidance document. So that very first paragraph, no matter how strong an entity's commitment to compliance or how effective the policies and procedures, training, and risk assessment, it is inevitable, guys, inevitable that a compliance officer will receive audit or monitoring results that raise concerns or receive a report through the disclosure program that requires investigating. So, yes, it would not be in their best interest to ignore the findings of an audit, and what this might mean for the organization. And another tip that I love that these tips in here, because it's like, hey, think about this. What if this happens? If over time a compliance officer does not receive this type of information, they should consider conducting a compliance program effectiveness review. If you're not getting information on making changes or investigating things, there's probably an issue, because there is something going on that has not been brought to your attention, because we're imperfect. Everybody in the organization is not perfect. They're going to make mistakes. Somebody might try to sweep it under the rug due to fear. Most of the horrible things that happen in the world are due to people being fearful of other things, of getting found out. If you make a mistake, it can be fearful to bring it up to somebody. And so these things are a progression of that feeling of fear. And so we have to try to control that feeling, because it's not in our best interest to be fearful of doing the right thing.
And
Or,
I also,
you
oh,
know,
I'm sorry.
go ahead. Sorry. Yeah.
No, yeah, I was going to say that a lot of times, and I hate to say this, but we talked about this before. A lot of times, the compliance officer or the compliance director or whatever is um, exceeded in bandwidth.
Mm-hmm.
And because they're exceeded in bandwidth, they don't have the attention span to pay attention to the things that they don't know about. All they think are just about the bare bones. But what we're talking about here is understanding all of those bare bones and enforcing them when they need to be enforced. And I think the bigger issue is, you know, is that compliance officer really caring about what's compliant? Depending upon the size of the organization, but you still have to be mindful that you're the compliance officer, and it's your job to make sure that when findings occur, when there's a report, when somebody calls on that hotline, that you need to investigate it and follow all of the steps as accordingly.
Exactly. And it's not easy. We have to be aware of all the moving pieces all the time. And it's not easy to say, okay, you violated this compliance policy. We've told you many times. And maybe now their job is on the line. But they're adults. They know, they should know what their responsibilities are. If you break the law, you suffer the consequences. That's just part of being a human. In living in a structured, system that like we live in. So we can't expect to, be get off scot-free. But the first section of that, element number 7, number 1 says investigations of violations. So this is really important to pay attention to. The violations of an entity's compliance program, failures to comply with applicable federal or state laws, and other types of misconduct threaten an entity's status as a trustworthy organization capable of participating in federal healthcare programs and the healthcare industry. So it's an organizational thing. I'm going to go back to this. It's not personal, guys. It's not picking on me. I'm not picking on you. We are picking on what you did. It's not you, it's what you did. And we have to protect the organization because we have actual patients that will be in danger if they don't get the healthcare services that they need. And this physician, although being an amazing physician or surgeon that can help this patient, now is in trouble under the organization because of what somebody else did. And so, as a physician, if you own your practice, you should know what's happening because it's your reputation in the community and as a physician that's on the line if your staff is making egregious mistakes that you're not aware of. I don't know. What do you think, Maya?
You know, and you just hit on something. And a lot of times when when a physician is owning, I'm trying not to burst at the seams because you know me. Um, when the physician is in charge, right? The physician knows patients. The physician knows medicine, but they don't know compliance. And I think a lot of times the mistakes that they make is that they don't have a professional compliance person in the practice. That's where we come in, Jen. And it's important for the physician to know that there are certain rules and regulations that is important for the organization or the practice to run as a whole and to understand the compliance regulations when it's understood that they are compliance regulations, right? So I think, this could be something. This could be something like, what if a physician decides to get a license to run a practice? And in order to get that license, you need to take a compliance course and make it a course that's understood and give all of the necessary requirements for you to understand how to run that practice as a whole, rather than saying, oh, I didn't know I was supposed to do that. Oh, this person changed the date on a claim. Oh, well, I thought I was able to do that because I didn't finish seeing the patient until that day. So, in my opinion, I think that's important, but, compliance as a whole and the physician being in charge, there's too many holes in the cheese in that scenario. And physicians need to unpack everything that's related to running a practice and being compliant.
Yes, and there are, things put in place in a functioning practice where it's not a dictatorship and it's, the laws are put in place and within the organization, you have contracts in place that if a physician-owned practice, if a physician violates something, they know what's going to happen to them. They're not going to be able to get off scot-free. Their compliance officer is going to enforce it. They have to report things to certain entities. So, for instance, number 2, reporting to the government. As a compliance officer, even an office manager, physician, you're all responsible to make sure that if violations happen, whether it's you or somebody else, it gets reported to the proper authorities. That is responsible business ownership. It's understanding those laws and regulations, whether it's a HIPAA breach or maybe an allegation of fraud. Maybe it's, a lot of nursing home fraud these days, things like that, where actual lives are at stake and the things that happen there. We have several entities that might get involved. It mentions, of course, the DOJ, the Department of Justice, the OIG, CMS, Medicaid, fraud control units, all kinds of investigative organizations can get involved. And it goes into a lot of that. Number 3, which I want to talk about now, is that last part of the equation is the corrective action initiatives. So now we've uncovered the issue. We know it's been a violation that we already warned was a violation. They knew it was a violation. It still happened. Now, it may have happened not intentionally, but it was still a violation that has to be reported, right? Not everyone intends to defraud the government or defraud someone else. It doesn't happen intentionally most of the time. But even if it's unintentional, we still have to respond to it, right? We have to make corrective action. So it mentions once the entity has gathered sufficient credible information, not made up, but credible, to determine the nature of the misconduct, you should take a prompt action. So, for instance, refunding overpayments. Yeah, it would be nice to keep my money. I would love to not have to send this back, but I violated the law and I submitted money claim for something that didn't happen. Or I submitted a claim for something that wasn't covered and there was a policy on it. Maybe I didn't know about it, but there's no excuse for that. That is still a violation, and we have to return the money because we submitted a claim that was considered fraudulent or incorrect, and we have to correct it. And then if we find out that it was maybe an education issue, we could provide education. But what if, Maya, it is something that we uncover that was intentional? And after interviewing that person, we find out that they're just the bad actor and they just were trying to get away with something. What do we do then?
Well, if they're a bad actor, that's falling under the False Claims Act. The False Claims Act has very strict guidelines as it relates to claims. And even if they are bad actors and they did what they were told, they still are responsible because they still are part of the entity, and they could hold the same limits of the law that are associated with the False Claims Act. And I think part of the issues that come across is that they need to, if they see something, they need to say something. And if they don't say something, then it becomes an issue, right? And everybody's guilty because everybody is falling under that person that falls under who's been told to do that. So the very serious thing is not necessarily the act, it's the penalty, the monetary penalties that are associated with each act, not just, one claim, it's each act. The number escape, I think, is between 15 and 20,000 for each act that falls under. So if the government finds out there's a number that's associated with each act, and then the money that you have to return based upon that. So just think of it this way, people. When there is a False Claims Act and there is a penalty that's associated with that, you're not just paying the money back, you're paying the money plus the fines. I have consulted on a case where it was for the state, and it resulted in over $4 million. And the way that they come up with these numbers is that they're statistical, and that they go by the the universe of claims that have been submitted. So if they think if you have a bad claim and you have been found out, right? They don't only take the number of claims, they go by the universe, the total amount of claims that you've ever submitted, ever. And they multiply that by that claim, and that you have to pay all of that back, because in their eyes, if a certain percentage is wrong, everything is wrong, and that everything that you have ever submitted, you have to return if it follows the same guidelines based upon the statistical sample that they've taken.
Yeah.
So it's a lot of money. It's a lot of money. $4 million.
So it makes you think about what you do every day to protect the organization. And I love what they say at the very end, the very last sentence, which really sums it all up. The compliance committee, so sometimes the compliance committee gets involved to make sure that it's not just one person, it's an issue that needs to be brought to everyone, should ensure that the entity takes the necessary steps to prevent recurrence of the misconduct and to strengthen any identified areas of vulnerability. That could be a number of things, but it could mean that person is donezo. They are gone. They're bye-bye. Because they have committed something so egregious. They've cost the organization so much money, reputation, that it's only agreeable action that has to take place. Especially too, if that ends up putting them on the exclusions list. They can't touch anything related to a Medicare or federal, entity insurance, right? They can't touch anything that has to do with a patient who has a federal payer attached to them. So again, it's very important. And that's why we run exclusion tests and lists on employees, physicians, vendors. We do that for a reason. So, yeah, I mean, I think it's great to talk about these things. And again, we are going to have some amazing information at our Inspired Compliance seminar. So again, it's this weekend. Saturday is the day. And we are very excited to be bringing our amazing speakers on. We're really excited too about our attendees to really bring to the table what you're dealing with. And this is a great platform for you to jump on and say, hey, we're dealing with this situation. How do we handle it? Because maybe you're a compliance officer and you have been doing this a long time and you just need a second opinion and you need some guidance. Maybe someone else has gone through the same situation and you're like, I just need to figure out what to do here. That's what this is for. It's a forum for you to ask your questions, talk to others like you who have been through this and who need you understand better how to handle it. So that's what this session is going to be about. We have the amazing Dr. Delgado that will be coming on at our lunch hour, a quick little meet and greet for 20 minutes just to talk about some of the cybersecurity issues that they are dealing with. And I think it's a great way for you to get in his head because he's amazing. Now, I always tell everyone before every conference, and it always ceases to amaze me that people don't understand, but it's fast paced. I put on boot camps, guys. It is a lot of information. You are not required to sit in front of your computer all day long and get a headache and get sick, okay? The information is recorded. If you cannot sit all day in front of your computer, that's completely understandable. You just sat all week in front of your computer at work. It is okay to get up, walk around, take the dog out, get some coffee, like do whatever you got to do on your Saturday and still come back and listen wherever we are at the conference. You're still going to get your CEUs. It's recorded. You're going to be able to still get your information. We have options for that. So don't worry if you can't sit in front of your computer for 8 hours. It's the information we want to give you and you need to have it, but it doesn't have to be all in one sitting. Just do your best to sit through it as much as you can, get what you can. You're going to have the information, I promise you. So, that being said, I hope more of you can join and take advantage of this opportunity to get this great information. We hope to see you there. And of course, we are not done with season 4. We have a few more episodes this month through the end of the year. We're next going to go into several episodes on specialty compliance. So next week, we are going to talk about orthopedics and we'll go into other types of specialties like family practice, etc. So stay tuned for that. And we look forward to talking more about compliance in the next few weeks. Have a great week, everyone. And we thank you for joining the Healthcare Inspired podcast. See you next time.